Hi, I'm Anne. I've been nursing now for 51 years. I'm currently nursing in the outpatients in Llandrindod, I started nursing in 1972. I went from Builth Wells, where I was from, up to Liverpool to do eye nursing. I went to do general nursing, and then I first started my first real job as a nurse in Llandrindod, and here I am full circle again. Very different now. I work in the outpatients, where we have at least 11 different sorts of clinics, so many things going on, really interesting. And I've enjoyed a wonderful and very varied career. There's so much you can do in nursing. I've been working in surgical wards, medical wards. I've specialised in mental health forensics for quite a while. And I think nursing's amazing because it can take you in so many different directions. And you think about Llandrindod outpatients and you wouldn't realise that there's an amazing diversity here, because you can do rheumatology here, you can do orthopaedics here, there's paediatrics here, there's podiatry here. There are so many different things that you can get involved in. I come here at my age and have become more involved in gynae than I ever have in my life. And it's been truly wonderful to just diversify again. My career's taken me all over the place. I went to Liverpool and did eye nursing and I really loved it, but I wanted to do general, so I went to Hereford. Then, as I said, I worked in Llandrindod, which was wonderful, and I was working with geriatrics, but I also helped to deliver a baby here. Then I went over to Worcester and Hereford again and did eyes, and I did surgical, and I've retrained and done so many different things. And I went down to Berkshire at 46, changing my life again, to work in forensics. I worked at Broadmoor Hospital, which was again an enormous and interesting challenge. I also nursed a lot of people who were unwell there, and as a result got back into my general nursing and upgraded that at the Royal Berks in Reading. So in my life I've done lots of things. I've always nursed, but I've gone off and done other things like drive a library van and stuff. However, the one thing that brings you back to nursing always is the patients. Whatever's going on, it's amazingly rewarding. It's not just about saving lives, it's about changing somebody's day, you know, by just being there. I'm feeling quite tearful about this because it really does make a difference. And I've had a wonderful career in nursing. If you told me when I started that it would have taken me to all the places it has, I would never have believed you. And actually, I have loved the diversity. And what's wonderful is I have done the different trainings over the years, and the new training is fantastic for new people coming in, because you can stay where you are and train now, and at the same time have the reward that I've had and the diversity right on your doorstep. And it's a wonderful thing. It's more rewarding than anything that you can do in your life, just spending time with patients, and that's what brings us all back, and that's why we stay doing it. During COVID, I got talking to an old friend. In fact, my first ever boyfriend, and that's really what's brought me back to Llandrindod, because although I'd come back and forth to Builth to see family, just to come back and meet up with him again has been an absolute surprise, and not one I was expecting. But what really sealed it all was the fact that the job came up in Llandrindod, and I thought, whoa, this is so meant, so I had to come back and give it a go again. So here I am in Llandrindod, and also helping out on a sheep farm. Well, trying to.